Hello, and welcome to Boomer Health. My name is Maggie Ornazian, Director of Nursing at AmeriCare Home Nursing Services. I'm joined today with Shane Byse, Epidemiologist and Administrator for Oakland County Health Nursing Services. Good morning.
Morning, happy to be here.
So Shane, tell me a little bit about your background in healthcare.
Well, I've been working in public health for just under 20 years. I started as an epidemiologist here in Oakland County for the health division, and I did that for about 11 years, and then I moved into our nursing services, helping coordinate those for the last 8 years.
Wow, so on behalf of Oakland County, we thank you. So tell me, what does an epidemiologist do?
An epidemiologist simply keeps track of the diseases going around a community. And sometimes that community is a country, and sometimes that community is a county, or in some jurisdictions, maybe just a city. And they keep track of the trends, what's coming, what's going, what do we need to worry about, and if there is something increasing disease occurring more often, what can we do to stop that? Why is it happening? And they help give that information to policymakers, to nurses, and to other people in the healthcare community that can help prevent its spread.
Wow, okay, great. So now within the county, what are the major categories of services that we provide?
In Oakland County, you have your health division that provides some of the traditional health services you might think. You know, we have our environmental health. You know, they investigate the restaurants, they protect our water. We have our nursing services, and we have our nursing services, we have our clinic. They give you immunizations. We also have some nurses that go out into the home, and they help people have healthy pregnancies, and they help some people who are at high risk for illness, such as people experiencing homelessness. They help coordinate their health care. And we also have some health promotion services as well. So if you see any press releases from the health division, if you see anything on our website or our social media, our Facebook page, they're the ones that are putting together those infographics and that information to help get the word out about anything going around in Oakland County. Okay,
great. So how, as a county, do we measure up against our partners, neighbors around, and even nationally?
Mm-hmm. Nationally, Oakland County is one of the leaders in public health. And we've been recognized for lots of different awards, for lots of different initiatives in the public health world. But we can always do better. You know, there are some other leaders in Michigan in particular. I'll give some credit to Livingston, and I'll give some credit to Washtenaw County as well for the work that they do. And the wonderful thing about public health in Michigan is it's locally run. So there's a little under 45 local health departments across the entire state of Michigan. And so each one of those local health departments is responsible for knowing its community and responding to their particular needs. And we collaborate a lot. So if somebody's doing something really well over here, we say, mind if we steal that idea? We're gonna give it a try in our community. And so although our metrics are pretty good, mm-hmm. we can get a little bit better, and we do that as a team here in Michigan.
Okay. So there's a lot of teamwork here in Michigan.
Absolutely.
Oh, that's wonderful.
Mm-hmm. Okay.
So now globally, is there any public health concerns?
Well, the World Health Organization, every year they put out a list of various, the top 10 global health concerns that they have. And some of them you might not be too surprised to hear about on there. For example, HIV is on there, although there's been a lot of breakthroughs in treatment and care and prevention of that. It is still a concern globally. There's some other things that you might not be surprised to be on there, such as air pollution. For example, you know, there was a big concern just recently in India with some air quality concerns where, you know, people weren't able to leave their home. But there are some things that you might not have heard about, such as dengue fever. It's a mosquito-borne virus that causes rash, causes many deaths every year, and the area where people can catch dengue fever is spreading globally, as well as just this year recently, vaccine hesitancy. people a little worried about getting vaccines for themselves and for their children. That is globally one of the top 10 concerns put forth by the World Health Organization. And I can definitely agree that that is a concern as well.
Okay, wow. So we hear a lot about the word or term pandemic.
Mm-hmm.
How is that different from an epidemic?
That's a good question, because you hear them used interchangeably, you hear them used all the time, and the simplest way to explain it is an epidemic is something that is happening more often than normal.
Okay.
Okay? So we haven't had a case of smallpox globally, for many, many decades, thankfully. If we were to ever see a case of smallpox, even just one case, that could be considered an epidemic because it's more than what we normally see.
Okay.
All right? But typically what we talk about is, this is a really bad flu year. It's an epidemic compared to other flu seasons.
Okay.
A pandemic is an epidemic across the entire globe. And so the last pandemic that we really remember hearing about is the 2009 H1N1 flu virus that kind of swept the globe that year and did cause a lot of disease and a lot of deaths that year. So it was simply an epidemic across the entire globe.
Wow. Okay, I do remember that.
Yeah, yeah.
So what are we concerned about, or what are the public health concerns here locally in Michigan today?
Well, there's been a few that popped up, and probably some that maybe some of your viewers have heard about. Well, recently we've been seeing a few cases of rabies amongst skunks, and recently there was a cat that was infected with rabies, actually in Birmingham, that we think was bitten and attacked by a skunk with rabies.
Okay.
And that comes and that goes. Rabies is endemic in wildlife here in Michigan, in particular the skunk population. And so very simple recommendations. Don't handle wild animals. If you see a stray cat or a stray dog, don't pet them, don't handle them. As I'm a cat person, and as cute as cats are, I have to resist just picking up and feeding a stray cat that I don't know about. And the other thing is, since I am a cat person, I have cats. And I have them vaccinated according to my veterinarian's recommendations. So that's the other thing that we can do to protect ourselves from that. Also, I do have to mention hepatitis A. We had a recent hepatitis A outbreak over the last couple of years. Now, thankfully, we seem to have gotten a control of that hepatitis A outbreak. Hepatitis A is spread via food, via bad hand washing, the fecal-oral route. So somebody uses the bathroom, they don't wash their hands as well, and they shake somebody else's hand, or they prepare food for somebody, and then that person gets it. And hepatitis A is a virus that attacks the liver. And usually that person can recover from it. But if that person has other conditions, other comorbidities, it can be a very severe illness. And we have had people die during that outbreak. Now, thankfully, hepatitis A is vaccine preventable. So we really recommend everybody, even if they're an adult and they're not sure about their vaccine status, just go ahead, get that hepatitis A dose. It's an extremely effective vaccine, whereas with one dose, you're recommended two, but even with just one dose, 90% of the people who get at least one dose are going to be fully protected.
Wow. Okay. So what are the most available adult vaccines that you would recommend besides hepatitis A?
Yeah. Well, I do want to mention that the CDC has a wonderful app. It's if anybody goes to the app, an app store, whether it's your Google apps or your Apple apps or whatever, just type in CDC vaccine schedule. Wonderful thing about it is it's free. Download it and you type in, am I an adult? Am I looking up things for a child? And you type in adult, and then you type in your age. And then it gives you a list of all the vaccines that it's recommended for. If you're like, I want to know more about that vaccine, you tap on the name of the vaccine and it spins the screen around and it shows you a little bit more information about that vaccine. But some of the ones for your viewers that would probably be interested in, and this is one that, I'm 43 years old. I can't wait till I'm 50 and I can be recommended to get this vaccine. It's called Shingrix. It's the new shingles vaccine.
Okay.
There was a current shingles vaccine before Shingrix called Zostavax. And that was recommended for people 60 and older. And it wasn't bad. It was a live vaccine, and it protected 50% of the people who got it from ever getting shingles. Or if they got it, it wasn't as bad of a case of shingles. But still, people got shingles with that vaccine. So it wasn't perfect, but it was pretty good. This new vaccine is 2 doses over the course of 2 to 6 months. So you get 1 dose, and then maybe 2 to 6 months later you get the second dose. It protects people 97% of the time from ever getting shingles. And if you do get shingles, 70% of them, the post-herpetic neuralgia, the severe rash and the pain associated with that rash is dissipated. It's much less severe. And so this vaccine is extremely effective, and it's for people age 50 and above, and for some people outside that age group with perhaps some high-risk conditions. Unfortunately, due to that, there's been a high demand for it. Because it is so effective, people who are younger can get it, and so it's been hard to come by. And so I encourage everybody to reach out to our nurse on call. That's 1-800-848-5533. We do cover it. It costs about $140. We do take Medicare at the health division, but unfortunately, it comes and it goes with our supply. So keep reaching out to our nurse on call and saying, do you have any in? Can I come in and get it? We do take appointments in our clinic. And so we have an office in Pontiac and Southfield. But that is one vaccine that I really can't encourage people enough to get as it's available. It's also available in pharmacies and some doctors' offices as well.
Okay, wow. That's some great information. Thank you. So you did mention it's a live vaccine.
Yep.
So really quick, what's the difference between a live vaccine and an inactive vaccine?
Very good question. The old shingles vaccine's live vaccine, this brand new Shingrix vaccine, is an inactivated vaccine. The newer effective one is inactivated.
Okay.
There's not too many live vaccines out there. There's only a few. MMR, varicella, or your chickenpox vaccine for children. The old shingles vaccine is live, and some other ones, some people, aren't going to come across very often. A rotavirus vaccine and the old smallpox vaccine.
Okay.
But a live vaccine is simply the virus is weakened. The pathogen is weakened. It's in the lab and the manufacture process. They make it so that the immune system can still recognize it. It can still replicate in your body. However, it's unlikely to cause any kind of illness. Maybe if you're taking the MMR vaccine, you might get a mild rash, but that's about it. And that's because the way they make that vaccine, it needs to be live, it needs to be weakened to have that immune system respond to it. Most of the time, inactivated vaccines is all that's necessary, and they're killed. It's just bits and pieces of the virus, a little bit of the cell membrane or a little bit of this protein, mixed in with some other things called adjuvants that help the immune system recognize that piece of the virus. And so that later, when you are exposed to that illness, your immune system can leap into action because it's seen that. But as with like the flu vaccine, you might hear a lot of people say, oh, I don't want to get the flu vaccine. I get the flu from the flu vaccine every year. Every vaccine that is manufactured to prevent the flu, except for the flu mist, which is your nasal spray for people 2 to 49 years of age.
Okay.
Every other flu vaccine is killed inactivated vaccine. You cannot get the flu from those flu vaccines, or you can't get any other disease that's being prevented by a killed vaccine.
Okay. So who are some of the people at risk to receive the live? Is their immune system lower?
Yeah, so there are some, and it's out of an abundance of caution. A lot of these vaccines might be okay for people who have a severely compromised immune system, somebody who's on chemotherapy. There are some vaccines, such as the MMR, that is recommended that pregnant women don't get because we don't know the interaction with the developing fetus.
Okay.
So there's some people like that who shouldn't get live vaccines, but even with those recommendations, even with those preventive efforts, it's not too much of a concern. There's a question that comes up quite often. I want to get an MMR vaccine, a flu mist, or some other live vaccine. Can I be around my friend who's on chemotherapy? Can I be around my friend who has an a compromised immune system? The short answer is always consult your physician, but generally speaking, that's okay. There hasn't been any evidence that somebody who got the flu mist gave that to somebody else with a compromised immune system. So those types of instances just have not been documented.
Okay. So with flu season being here, we're giving a lot of flu shots at AmeriCare now. And we have a lot of older adults that come in, 65 and older, asking for the super flu. I'm older, I need the older flu vaccine.
Absolutely.
And what my question for you is, in a sense, as a nurse, I'm like, well, I have this flu vaccine right here, you should take this. What are the differences, and why do we recommend this super flu vaccine?
So there's two general kinds of flu vaccine. What we'll call, the regular flu vaccine, that maybe you or myself might be recommended to get. And then there's something called a high-dose flu vaccine that's generally recommended for those people age 65 and older. And basically, that is simply a supersized dose of what's in a regular flu vaccine. It just has more of it. And that's because, frankly, as we age, as we get older, our immune systems get weaker. That's why we give vaccinations as early as we can to children and to adolescents, because their bodies do a much better job of responding to those vaccines and becoming protected, sometimes protected for life. For us, as we're getting older, doesn't do as good of a job. And so our bodies, when we're 65 years and older, need that extra dose, that extra antigen that your immune system responds to have a protection. Now, what we recommend at the Health Division, if you're 65 years and older and you have access and you have a chance to get a high-dose vaccine, get the high-dose vaccine. But if you can't find the high-dose vaccine, if your provider in front of you says, I don't have the high-dose vaccine, I have the regular dose vaccine, can I give you that? And you say, well, I really want the high-dose vaccine, but maybe you leave that office and you don't get back to some place where you are going to get the high-dose vaccine. Bottom line is, get some protection. And if you can get it, or if you have plans to get the high-dose vaccine, get the high-dose vaccine and make sure that that's what you get.
Can you double dose?
If it's not recommended, you don't need to. It's one of those things where it has happened where somebody's maybe accidentally gotten the regular vaccine instead of the high-dose vaccine. And they say, oh, I really want to go get the high-dose vaccine. And they go back a few weeks later and they get the high-dose vaccine. There's generally no recommendation, or there's no contraindication to doing that. It can happen if there's like a goof up or a mistake made like that, like maybe your provider gave you the wrong kind of vaccine and you still want to get the high dose vaccine, but generally speaking, it's not necessary. The last thing I will say about flu vaccine is it used to only protect against 3 types of flu viruses that are circulating, that are going around the country. All vaccines now, all flu vaccines, protect against 4 strains of the flu virus. So it used to be that the high dose only had 3, the regular vaccine only had 4. Now no one has to worry about that. All flu vaccines protect against all 4 of the strains that are thought to be circulating around.
Wow, that's wonderful. And is that the CDC that does all of that? Yeah,
so the CDC is the one that in conjunction with the World Health Organization, they look at all the lab results that are coming in, all the reports, and they have an educated guess before the season starts of what they think, what flu vaccine strains they think are going to be coming around this flu season. And so those are the strains that end up in the flu vaccine.
Okay, great, thank you. So Shane, tell me, what is a booster shot? And then why are they needed?
Well, a booster shot is, you think like a booster chair, a booster car seat, or your young grandson or granddaughter or something sitting on that booster chair at a restaurant. It is really just a step up for your immune system that you've maybe had this vaccine before, but again, because we age, because we get older, our immune system, for sometimes forget. And you need a booster to kind of help your immune system remember and recognize those particular bacteria or viruses. A good example is a vaccine called Tdap. That is short for tetanus, diphtheria, and pertussis, or whooping cough. And those are a lot of viruses that maybe a lot of your viewers recognize just by name, but we haven't seen those, thankfully, for a very long time. Well, I think everybody's familiar. Oh, I stepped on a rusty nail. I cut my finger or something like that, and I had to go, and my doctor said, oh, you're late on your tetanus booster. You need a tetanus booster to make sure you don't get tetanus. Well, now, not only is there a tetanus and diphtheria booster, but there's also pertussis that's included in that. And that's because, thankfully, we saw that as we got more and more people vaccinated against pertussis when they were kids, that vaccine, that particular vaccine, unlike some vaccines protect for life, but this particular vaccine, the immunity waned. Your immune system forgot over time how to protect itself from that. And so people started to get pertussis again as an adult. And sometimes it can be a severe illness in an adult, but very often what happens is an adult who might get pertussis or whooping cough, they'll get a cough. It'll be a cough that just doesn't seem to go away, no other symptoms. And then 2-3 weeks later, they go into the doctor's office and they, okay, here's some antibiotics or something like that. But by that time, the bacteria is already out of your system, and now the leftover toxins from the bacteria are what's still causing that cough. And so those antibiotics don't do anything for you. And so that cough lingers, and it just maybe hasn't gone away. But you're up and around, you're moving, you're going to work, you're working out, you're visiting your family. During those early stages of that illness, you can still transmit pertussis to other people. You just don't realize it because you're not that sick. And so we recommend that adults get this Tdap at least once in their life, and pregnant women get it at least once every pregnancy, because it is thought to protect newborn babies who are too young to be protected against pertussis. And so maybe we know a grandchild or a granddaughter who a parent has said, oh, by the way, we need to make sure you get your Tdap, your pertussis booster, so that you don't accidentally give whooping cough to our newborn baby. That's a process called cocooning. We try to cocoon those who are too young to be protected against pertussis. And in infants, they can start to get their pertussis vaccines at age 6 months.
Okay.
Yep. And so that's where that comes from. And so that's a good example and a very relevant example, because we do have pertussis and whooping cough circulating in Oakland County and other communities.
Can it be detrimental to receive a booster if you just can't remember, and maybe you had it 10 years ago and I just didn't keep a good record of it?
I can't tell you how many times we got this question recently. Okay. Recently we had a measles outbreak, and we saw it in some older individuals who were thought, oh, well, didn't everybody get measles when I was growing up during my age? Most did, but some didn't. And so even if you had measles when you were younger, or even if you were vaccinated, but you just can't remember, did I get 1 dose, did I get 2 doses, how many doses did I get? It's okay to get that second dose.
Okay.
Because for most booster vaccines, the recommendation is to just not get it too soon. Okay. And by too soon, I mean usually within the last 4 weeks.
Okay.
Right, and so generally speaking, you would remember that. So it's okay if you can't remember to just be safer than sorry and get that additional dose of vaccine. For example, a friend of mine who works with us, a physician, he had to go around to all his different medical appointments and his residencies, and he had to get a measles vaccine every single time he went and have documentation with that. And so he's actually had the measles, the MMR vaccine, like 4 or 5 times, when usually you only get it a couple times when you're a child.
Right.
And he's had no reaction. It's fine. The only time you should never get a second booster dose of a previous vaccine is if you had a bad reaction, a severe reaction to the vaccine before. But again, you would remember if you had a severe reaction to
Absolutely.
a particular vaccine.
With the cold and flu season upon us, a lot of older adults are probably going to ask about the pneumonia vaccine. What can you tell me about the pneumonia vaccine?
Well, there's actually 2 pneumonia vaccines.
Okay.
And one protects against 13 strains of the bacteria, a common bacteria that causes pneumonia, and one protects against 23 strains. And so somebody might say, well, just give me the vaccine that protects against 23 bacteria strains. Why am I even going to bother with that one that only protects against 13? Well, it's because they complement each other. Any one vaccine of those 2 vaccines that is called Prevnar and Pneumovax, if you get just one of those vaccines, it's not bad protection, it's better than nothing, but when you get them together, one after another about a year apart after the age of 65, they kind of complement each other and make each other stronger and help your immune system have a better response. And I can't stress enough about the importance of getting that one as well.
Okay.
Because pneumonia is, it hospitalizes many people annually, especially people who are over age of 65, and it does still, kill people. And so Prevnar, that's a vaccine that started to be given to children, and it was found that in families and in groups, when their kids got that vaccine, those kids, because they get the ear infection or maybe they get some other kinds of milder types of illnesses or that kind of thing, they didn't pass it on to their grandparents. And so it protected their grandparents because they were getting vaccines. And so the same thing, if the grandparents get that Prevnar and they get that Pneumovax, it helps to protect those younger kids as well.
Well, is there anything else that you'd like to tell us?
A couple things I just like to remind everybody that they might find helpful. Again, one is a reminder about our Nurse on Call line. If they have any questions about anything that I've spoken about today, or if they have anything else about any other questions about the health division, or even if it has nothing to do with the health division, our Nurse on Call is really great about getting them connected to other community services, even unrelated to health. Perhaps they're having trouble with their water bill. They can get them connected to those services to help out with that. Or perhaps they're having difficulty with some other things. They can help connect them to community resources, not just those that we have at the Health Division. But as a reminder, that phone number is 1-800-848-5533, and that's Monday through Friday. The other thing that they could talk to our Nurse on Call about, and I really encourage them to do so, is Oakland County has taken the initiative to get a contract worked out so that it's called Live Healthy Oakland. It's a program that's kind of a supplemental insurance program, and it can help reduce prescription costs as much as 24% for some individuals.
Wow.
And the prescription portion of the plan is free of charge to any and all Oakland County residents. All they got to do is sign up for it and get the card. And that's called Live Healthy Oakland. And if they call and reach out to Nurse on Call, they can help direct them to the website to get them signed up. There's also a medical portion of the plan and a dental portion of the plan. Those aren't free, but they're very low cost, as low as about $5, $6, $7 a month for those. And they can help supplement and kind of, for example, if there's lots of co-pays, they can help, or a high deductible, they can help out with those things as well. And again, all 3 of those programs, the free prescription and the low cost medical and dental, those are for all Oakland County residents, and all they got to do is call our Nurse on Call, 1-800-848-5533, to get more information about that.
Wonderful. Well, thank you, Shane. This has been very informative.
You're welcome. Thank you for having me.
That concludes this edition of Boomer Health. I'd like to thank you all for tuning in. And again, if you have any questions, please contact me at AmeriCare at 248-288-2270.